Hey there, this is Medical Johnny, and let's continue on with some A's, and we're going to be moving into B's now, okay? So, artery. Probably heard like a heart artery or something like that. A blood vessel that carries oxygenated blood away from the heart. So, there's two types of wires, I could say, that connect to the heart. The first would be something like an artery, which takes away, and then something like a vein that would take it to. So, as your heart pumps, it pumps blood into the foot from the heart. So, for example, just it goes into the foot. Well, it doesn't stay in the foot. It has to go back up to the heart. So it goes down through the artery to the heart. Away from the heart to the foot. And then it'll come back and recycle into the heart. So it goes away from the heart in an artery. Arthritis. Probably a lot of people have arthritis, and a lot of people know what it is. I have arthritis. It's not nice. Chronic condition of inflammation of the joints. So, for example, chronic is something uncurable. You can't cure chronic, but you can treat its symptoms. So what that means is that with chronic, if you have it, you can't make it go away for good, but you can treat the symptoms so it's not as bad. For example, you can't cure arthritis, but you can take pain medicine and it'll make it less painful for a day, if you can understand that. So arthritis is chronic condition of inflammation of the joints. When your joints are inflamed, or if they're rubbing together, if the joint's gone, and you just have two joints rubbing together, and because of that, you'll get the swelling, you'll get an inflammation, and that would be arthritis. A sepsis, the absence of microorganisms, and then in parentheses germs, free of disease-causing organisms. So a sepsis. Excuse me, I just had Coke. Cane. Okay. The absence of microorganisms, which is germs, free of disease-causing organisms. So, I'm guessing if you make something a germ-free zone, maybe like a hospital room, surgery room, excuse me, you would have a sepsis. So it's free of just negative germs, free of disease-causing organisms. It's neutralized. I'm not exactly, can't remember the word right now. Sterilized. To sterilize it, a sepsis. They do that with a lot of medical instruments so that the next person having surgery or getting a shot or something like that doesn't have the germs from the last person. When they rub that little alcohol when you're getting a shot, it's dealing with a sepsis. And then aseptic is germ-free without disease-producing organisms. Aseptic. That room would be aseptic. The germ-free room would be aseptic. Aspirate. This is a different word. I had this conversation with my father just yesterday. There's two types of words dealing with the type of word aspiration. The first one is I aspire to be an actor, a boxer, a president of the United States. That's aspiration. But there's a medical term, just like I was talking to you guys yesterday, in the A videos. Remember how AKA is also known as, but it's also above knee amputation. There's two different words for aspirate in the English language that we're dealing with right now. Aspiration, as in I aspire to be something, or aspirate, which is material inhaled into the lungs, which could be liquids, food, vomitus. So if you accidentally have something in the lungs, you're eating and then you go, oh crap, it's in my lungs, that would be the aspirate. You got it in your lungs. If you're drinking water and some go down the wrong tube into the lungs, and you can drown on a teaspoon of water if it's all in, that would be to aspirate, you getting it in the lungs. And a nice tricky way to remember that is aspirate, respirate, right? So the respiration system is the breathing system. Respirate, aspirate, the parate. You can remember it like that. Assessing, gathering facts to identify needs and problems. So that should be an easy one, but for the ESL people, I'll go through it. Gathering facts to identify needs and problems. To assess or assessing. Assessing is the act of assess. You will get evidence and identify the needs and problems. So if you're assessing the situation, there's blood on the ground, the patient's not in the bed, and there's a foot sticking out of the bathroom doorway. Pretty much the patient got out of bed, there was some bleeding going on, and they tried to go to the bathroom. You're just assessing what's going on right there. Atrophic skin. Thin, fragile, less elastic skin frequently associated with aging. So it's the older you get, the worse everything in your body gets, which is pretty obvious, and the worse your skin gets. So the thin, fragile, less elastic skin. So old people are very, you can see in old people how they cut easily and their skin is just not good quality, all that kind of thing. Thin, fragile, less elastic skin frequently associated with aging. Young people can have it too, or people who went through surgery can have it too. When they get liposuction, the skin doesn't want to stretch, or when they get surgery and they have to cut out skin, they have to stretch skin. Your skin is flexible, but the more you stretch it, the less quality you're going to have. And so it's not always with aging, but mostly it's associated with aging. It's just the atrophic skin. Just think of it, the way I try and remember it is catastrophic skin. You know, bad stuff is happening with your skin because of aging. Catastrophic, atrophic. And then atrophy, which is different than atrophic, because it's atrophic skin, but the next word, atrophy, is not with skin, because it doesn't have the word skin next to it. Atrophy, wasting away of muscles, decrease in muscle size. When somebody is in a coma, and they're laying there and laying there and laying there months, weeks, years, something like that, they're not getting muscle use. A lot of astronauts who come back down to Earth have to train for weeks and months to get their muscles back because they don't use muscles in, like walking around muscles in space, because they float everywhere. A lot of patients who are in comas, they just lay there and their muscles aren't used, so they start wasting away. So that would be atrophy, the wasting away of muscles, because they're not being used and they decrease in muscle size, as it says here. So it's atrophy, is wasting away of muscles. Autoclave. Autoclave. Device used to achieve sterility of an item through heat, pressure, and steam. I had a debate with somebody about this. You don't really need the heat and steam. We couldn't come to an agreement if that was the same thing or not, but I'm going to trust the medical book here. Device used to achieve sterility of an item through heat, pressure, and steam. It's an autoclave. I'm not particularly sure about everything that it is. I just know what it does. I don't know what it looks like. Just autoclave. You'd have to get some... This is why we go to CNA classes, so they can teach us about this. I would ask your teacher about that. The teachers, can we trust them? It's a device used to achieve sterility of an item. So remember we went back to the aseptic word. Okay, we're mixing and matching here. Through heat, pressure, and steam, and sterility to sterilize, aseptic to get rid of the germs. So Basically, it cleans the germs off of something. Autonomic nervous system, ANS, autonomic nervous system, the part of the nervous system that carries messages without conscious thought. The autonomic. That's how I can remember this. Is auto, it means it just happens, right? It just all of a sudden happens. You know, when you don't have to remind your alarm clock to go off, it's auto. So auto nervous system is how I remember this. But it's autonomic, but auto nervous system. When you stub your toe, or an ant bites you, or you cut yourself, and you didn't know you cut yourself, and you feel the pain, you didn't have to think about feeling the pain was just there. So it says the part of the nervous system that carries messages without conscious thought. You didn't have to think about the pain. The pain was there automatically. You didn't have to remind yourself that you're in pain. You don't have to remind your alarm clock. The autonomic nervous system. Auto nervous system just works without even thinking about it. Axillary. The axillary for all of the, this is an anatomy word. It's part of the body. It's axillary, the area under the arms, the armpits, right? The axillary, you know that place where the stink happens? The axillary. Bacteria. We're on the B's now. Unicellular organism. Unicellular organism. Bacteria is a type of cell, one cell. It's not multicellular, it's uni, it is one cell that grows and grows and grows and grows and causes disease and all that kind of thing. Not always. It could help you get better. Some of them are not harmful. A lot of them are not harmful. You have bacteria all over you. You are absolutely covered in bacteria. It's just they are bad bacteria as well. It's a unicellular organism, microorganism. Microorganism being something micro, so you can't see it, and unicellular, one cell. That's very important. You have to remember that it's a unicellular organism. Bacteria. Bargaining. Bargaining. Trying to make a deal to change the situation. This is one of Elizabeth Kubler-Ross's 5 steps that people go through when they're dying. You remember you have bargaining, acceptance, you know, all that jazz. I can't remember the 5 right now. I should be able to remember them, but I'm making a video and my mind's blank right now. Trying to make a deal to change the situation. Bargaining. Well, what if I could have not smoked it as much, or as smoked not at all? What if I stopped smoking? Will my cancer go away? You know, why is this happening to me? In the confusion, well, what if I stop smoking? I swear to God, I will stop smoking. Please just make the cancer go away. I swear to you. That's part of the bargaining. So trying to make a deal where it's between your doctors, yourself, your family, a higher power, to change the situation. Okay. Bed alarm. A control unit that activates an audible alarm in the nurse call system when the patient's weight leaves the pressure sensitive mat for a pre-selected amount of time. Because you are going for a CNA maybe, this is mainly for CNAs, vocabulary for LVN, LPN,